like vitamins, antioxidants, actually have a higher death rate. Dr. Ofit told us about that on several appearances, and it's also in his book with the references. So we're going to take a little break, hear from some voices, and we'll be right back. This is Dr. Lederman from Radiosurgery New York, Cancer Treatment Center at 38th and Broadway, where we treat cancer to knock it out.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and we're talking about all kinds of issues. I just wanted to remind you that in the New York Times this week, there was a headline that says, prostate cancer screening still not recommended for all. The first sentence says, that was a headline, there's an article by Tara Pope. A major European study has shown that blood test screening for prostate cancer saves lives. That's the first line. A major European study has shown that blood test screening for prostate cancer saves lives. So, what's the doubt about? Well, the doubt about is, what's a life worth? Now, who's measuring the life? Is it you measuring your life? Or is it some insurance company measuring the value of your life? Or is it Obamacare measuring the value of your life? The study is very clear. This is the first sentence. A major European study has shown that blood test screening for prostate cancer saves life. The man I just talked about, when he had a PSA 10, he would have had more than a 90% chance of being cancer-free if he was treated, yet he decided to go with basically no treatment or harmful treatment. So let men understand. A major European study has shown that blood test screening for prostate cancer saves lives. Do you want your life saved? Or do you want to save money for your insurance company? You should learn the facts, learn exactly what the facts are, and you decide. You get to decide. You're the President of the United States. If you want to be screened or not, if you have an elevated PSA, if you want to be evaluated for the possibility of cancer, and if you have cancer, do you want to be treated and how? And do you want the best possible treatment with the likelihood of maintaining your sex life and your urinary life and avoiding radical surgery? Or do you want to have something else, which is probably riskier? And we just heard earlier in the show how common complications are in open surgery, about 35% of the time. And complications cost money. They harm the patient. They are $39,000 just to repair the complications, not to mention how much psychological harm away from work, away from family, away from loved ones. Wouldn't you rather have a treatment that's out of a hospital, away from superbugs, in a private cancer treatment center where you're the boss, not the pharmacy industry, not the drug industry, not the surgeons? Doesn't that make sense? Not to mention, if you get a center that's in the heart of Manhattan, that's next to Penn Station and Grand Central and Port Authority and subways and buses and trains and PATH trains. And that's why we located our center at 38th and Broadway. We're a private cancer treatment center devoted to you. We take most insurances, Medicare, Medicaid. We return your calls. We send you information. You have a doctor taking care of you, not the student, not the nurse practitioner. Everyone's great, and I love them all. But when you're sick, you may want to be able to deal with the doctor trained in oncology, the doctor whose number you have, who you can speak to 24/7 if you need to. Isn't that a better way of getting care than the answering machine and not being able to talk to your doctor? Don't you want to talk to your doctor if you have a problem or a question? And here's another patient who has metastatic breast cancer to the cauda equina. The cauda equina in Latin means the horse's tail. So where on this woman is her horse's tail? Well, this woman has a horse's tail, and so do you, too. We all have horse's tail. The cauda equina is the end of the spinal cord where the nerves all break off. And when the nerves all break off, they're little filaments that look like a horse's tail. Well, her cancer traveled to the horse's tail, the cauda equina. It got through the spinal fluid. We treated her. She has no symptoms. She's doing great. We did pinpoint treatment in the stereotactic frame, so we're able to focus the beam without side effects, and she tolerated the treatment very well without side effects. I know a lot of places use standard radiation in large fields. No, we're able to focus the beam on the cancer, hit the cancer. She tolerated it well, doing great. And here's another man I want to talk about just for a moment who had kidney cancer a couple years ago, went to a cancer center. They removed his kidney, his whole kidney for kidney cancer. Now he's down to one kidney. He's lost one. And came to us with pelvic pain. The man was worked up. We found a cancer in the opposite kidney. No. He does not want another surgery. He's been through surgery. That's what we're talking about. He's been through surgery. He wants radiosurgery, and we're treating him with radiosurgery as we do for many people with kidney cancer. Our success rate is quite high in the kidney or beyond. There's an article, a news article from UK, and it says statin use after colorectal cancer diagnosis reduces cancer mortality. So it was published in the Journal of Clinical Oncology, which is a big cancer journal. It was written up by Matthew Stengler. And what doctors found is that statin drugs, those are the drugs that people take for cholesterol, that statin use after the diagnosis of colorectal cancer was associated with a 29% reduction in cancer death and an overall 25% death rate altogether, and the best results were in patients taking the statins for more than a year. The study involved 7,000 patients with newly diagnosed stage 1, stage 2, stage 3 colon and rectal cancer from the UK. They were followed, and interestingly enough, patients taking statins had a markedly reduced 29% reduction in death rate. So it's good news, great news, and news that we all want to share. In these days of sunny weather, again, you may want to cover up and put on sunscreen and wear a hat and some long sleeves. We just finished treatment on a patient, an Irish-American, who had 4 skin cancers. He got all 4 treated. They were basal cells, but we treat squamous cells, basal cells, Merkel cells, melanomas. We treat them because often surgery is deforming. This man had 4 lesions, 4 cancers, 1 under the eye on the left, 1 above the eye, and 2 in the scalp. Surgery would have been very deforming. He had radiation, focused beam with us. He just finished the treatment and in remission already. So he's done great. If you have questions, please give us a call. This is Dr. Lederman at Radiosurgery New York. We have a free booklet DVD. If you just call us during the work week, 212-CHOICES. We'll mail it out to you at no charge. Again, our number is 212-246-4237. If you have medical questions, call anytime, day or night. This is Dr. Lederman. We wish you well. Thank you for tuning in, and God bless you, and talk next week.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within 1 business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
The proceeding was a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed, 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 or the ideas